2 years ago, kids were just beginning an odyssey of disruption, virtual learning, masking, cohorting, and other restrictive school protocols. Monday, once everyone is back from March break, students will walk into schools and classrooms almost as they were before COVID-19. With us now for their thoughts on that very big change. In Malmore, Ontario, just north of Orangeville, Karen Brown, president of the Elementary Teachers Federation of Ontario. And in the provincial capital, Aia Lederer, parent and private school teacher. Tai Huynh, editor-in-chief of The Local. Hi, everybody.
Hi. Hello.
So I have two kids Monday who are going back to school. One child has said, yay, masks, never again. And one child is, I don't know. So it's great that we're having this conversation. Aia, let me start with you. As a middle school teacher and a parent of two, what are some of your concerns on lifting mask mandates and other measures like cohorting?
So for myself as a middle school teacher, our school has maintained Rotary, and I am exposed to almost 90 students on a daily basis. So for me, removing my mask is a little scary in the sense that I want to keep my family safe. I want to make sure that we are all doing our part. I want to keep my students safe, their family safe. So removing the mask, being exposed to so many people on a daily basis is a little frightening. My children, I will say that the community that we live in has been very fortunate. We really haven't had a lot of cases in the two schools that my children are in. So whatever we're doing as a community is phenomenal. Both of my kids have stated independently that they plan on continuing to wear their masks when we go back to school on Monday. So from that perspective, I'm pleased that they're doing that. But either way, I would support whatever their choice is.
And Karen, in the statement released by EIUTFO after Dr. Moore's announcement last week, you said, lifting the mask mandate too soon may result in further disruption to in-person learning and negative impacts on the health and safety of ETFO members, students, and their families. Ontarians deserve stability and safety, not more chaos. The government has made the argument that Ontario was the first jurisdiction in the country to require masking in schools and has been one of the last provinces to lift the masking mandates. What concerns you most about the mask mandates being lifted on Monday?
Concerns, first of all, our members, everyone wants this pandemic to be over. We want to see the beautiful faces of the students in our class. And they want to see the faces of their educators, their classroom teachers or their early childhood educators. So we're all on the same page with that. Our concern with lifting the masking is that they're lifting masking and a whole series of other precautions all at the same time. So there's no longer going to be masking. There's no longer going to be cohorting. There's no longer going to be social distancing. There's no longer going to be screening. All these measures which were put in place to help our members feel comfortable, to help parents feel comfortable, to maintain stability in the system is going to be removed. And these are a concern. When you have crowded classrooms, that's a concern. When we see that the population of students that we're serving, the majority of those students are not vaccinated, they can transmit the virus to our members, to our colleagues. That's a concern. We're saying let's slow it down. Let's take some time and let's just see the trends. Let's see what's happening. To remove all those safety mechanisms is a real concern. Masking was something that we had pushed. It provided an added layer of protection for our members. So with that added layer of protection removed and all the other layers, it brings a concern. It's currently still in Ontario. We're still scrambling for supply teachers. Boards are still using emergency supplies. So the stability that we were requiring in the system is not going to be there. We're seeing parents already talking about switching from in-person to online. We're really concerned that we need to see the trends, give an opportunity for us to be able to transition to that. To have a huge number of children now going to be eating together in a lunchroom, going to be together at assemblies, going to be together at performances, going to be on a public transit. It opens the system to a lot of instability.
Tai, I know you're a parent, and one of the things during this the pandemic that kind of put my mind at ease as a parent was checking to see how many COVID cases were in schools. The province stopped doing that, but you have been tracking COVID cases in Toronto for schools for a while with the local. Why was it important for you to do that?
I think parents just want to know, right, and to take the necessary precaution. I know, depending on which neighborhood your kids go to school in, I think the risk could be dramatically different, right? We're seeing that now with the masking mandate being lifted. I think a lot of parents are concerned about, well, to what extent are the kids vaccinated, or teachers are concerned as well. To what extent are the kids vaccinated in the school where my kid goes to? And the reality is you have neighborhoods that are located right next to each other that have dramatically different vaccination rates. In Toronto, for example, two neighborhoods, one Thorncliffe Park, the other adjacent neighborhood, Leaside. Leaside has 73%, kids vaccinated. Well, Thorncliffe Park has only about 14%. So you can imagine the kind of anxiety that parents in Thorncliffe Park, might feel about kids removing their masks next week. So these things matter at a very hyper-local level, and I think parents have been relying on some of our data to really help them make some of those decisions, whether it's masking or distancing or other types of precautions, staying home, doing virtual learning, et cetera.
Well, you mentioned the different areas that people are living in the city. You wrote about how the impact of COVID looks different for students across different neighborhoods in terms of vaccine equity. Here's some of the top and bottom postal codes based on vaccination rates for children aged 5 to 11. And the data is sourced from COVAX Ontario and for 2 doses. At the very top, we've got Laird Eglinton at 73%, which is just up the road from us. Rochesville Dundas is at 72%. The Kingsway Bloor, southwest of Toronto, 71%. Keele and Eglinton, northwest in the city, 17%. Jane and Finch, northwest in the city, 16%. And Thorncliffe Park, Overlea, which you just mentioned, is at 14%. What do those numbers indicate to us as we move forward with removing masks in schools?
Yeah, what the experts are saying is, the risk depends on to what extent we have this immunity wall to protect us, right, when the virus is still circulating in pretty significant numbers. So you're either vaccinated, that gives you some protection, hopefully fully vaccinated, or perhaps you've caught COVID before, and that offers you some protection as well. The latter, we simply don't know because we haven't been tracking real COVID cases for some time now, and the testing system isn't, at the capacity where you could do that at on a large scale kind of basis. So what it comes down to really is vaccination rate. That's the numbers. Those are the numbers that we know with some degree of certainty. And yeah, as you saw there, huge variation in the city of Toronto. Across the province, we're seeing similar variation. You've got some neighborhoods in places like Peel or Windsor where it's very similar, like 12, 13% vaccinated. Whereas you have other neighborhoods across the province that are 80, 90% fully vaccinated for kids. So, yeah, so it all depends on where the school is located.
Aia, a student-led group has called for a province-wide walkout on Monday in protest of the mandates being lifted. School boards have said that they will continue to be masking-friendly environments. Some parents have said their children will continue to mask. Is there any confusion from parents about what's the right thing to do?
I don't think so. I think parents, I think you really have to be a parent at this point, and you have to make the right decision for you and your family. The key thing is, I don't think anybody really knows what is going on behind somebody else's doors. And for people to automatically assume that it's okay for me to take my mask off, or I'm going to keep my mask on for a little while longer, that division shouldn't be there. I know it will probably be there to some extent, and it will seem awkward for some kids who are still wearing masks and some kids who have removed their masks and conversations around that. But I really feel like this is a personal decision, and that personal decision has to be respected.
Karen, it is one thing, just building on what Aia said, for people to respect each other's choices. But in those classrooms, it's not going to be the adults in those classrooms. It's going to be children, right? And my kids never miss an opportunity to remind me that they've been wearing masks for 6, 7 hours a day, something that I haven't had to experience. Now, this is going to be a situation where some kids might wear masks and other children might not wear masks. Are there mixed responses from parents now that masking becomes a choice?
I think there's been a mixed response. Some parents, like us, are very concerned that the timing of this removal of masking right after the March break, a time when we normally see a higher spike in cases of COVID. So really trying to grapple why the urgency at this particular point. Why not give a little more flexibility so that parents can feel comfortable that like you said, we're not tracking any numbers. We have no sense of what's happening with the COVID cases, really to give them that reassurance. So for those parents, masking, the delay of it's really important. For other parents, like it was mentioned before, their personal circumstances might be different. They're fed up with it. We do provide mask breaks in the schools, but they want to move on from COVID. But they might not have a child that has an immune compromise, who's immune compromised. There might not be anyone in the home, an elder and a family member that they're living with or have to be in contact with that impacts why they're making this personal choice. Or they just simply don't feel comfortable because they know the realities of their child's classroom. The typical elementary classroom, it's going to have 30 to 40 kids in that classroom who are no longer masked, no longer physically distanced, with about maybe 55% of them actually vaccinated because they're between 5 and 11. So the majority of the elementary students are not. And if they're in kindergarten, there's a large percentage who aren't eligible for vaccine and they're not masked, they're not socially distanced. All these layers together, and they're no longer cohorting. They're mixing together. They're interacting right after a break, a time when people are socially interacting together. Is a reason for concern. So I think all those factors, families are going to make their personal choices, but I think families who are connected, who've been in the school, who knows what the inside of a school actually looks like and what kids are doing and how they're sharing resources and materials and interacting and leaning and touching, have some valid concerns. And that's what we're talking about. We're talking about not just out in the community, but what does it look like navigating COVID in a classroom? We need to do that cautiously for everyone's safety.
Tai, the Children's Health Coalition, which represents children's hospitals in Ontario, said that it prefers for the mask mandate to be extended for at least 2 weeks past March break. The Education Minister, Stephen Lecce, has told school boards who wanted to keep masking in place for that period until April 15th to not do that and to follow what the province has stipulated. A school in Hamilton has made the decision to extend its mandate until April 1st, and so has the private school that Minister Lecce went to, St. Michael's, until at least April 17th. Throughout this pandemic, we heard from the government and including Minister Lecce that the boards could, make their own decisions based on, I think for some boards had extracurriculars at one point and others didn't. So are you surprised that boards now are not allowed to make this decision for themselves?
I'm not sure surprise is the right word. I think inconsistent is probably the right word. I think, as you said, private schools are able to do that. Universities are able to keep masks on while public schools aren't. Public schools have in the past been able to institute their own health and safety protocols beyond the government policies. So, for example, last year, the provincial mask mandate only applied for grades 4 to 12, whereas many school boards decided to additionally add the mandate for those from kindergarten to grade 3. And this year, similarly, I think the provincial mandate only covered those from grade 1 to 12, and most school boards extended that to JKSK as well. So these have been things that have been done in the past. I think right now, it feels inconsistent, I think, and that's what a lot of parents are saying, looking at this from the outside of the tight policy circles, that some of the conversations have been happening that, wait a minute, why are these decisions being made now? And they seem to be different than what school boards were able to do previously.
And we've also seen arguments that kids are low risk and unlikely to develop severe symptoms from COVID, and that the reopening of school has not resulted in significant increases in cases. Why do you still think we're not ready, Karen?
We're not ready because the layering of factors. It's not just removing one safety mechanism. It's several layers at the same time, and that's we talked about flexibility that's been allowed in the past, and the ability to have enhanced safety measures. So this is just an enhanced safety measure that boards want to have. They want to have that flexibility. They're dealing with the day-to-day staffing. They're dealing with their principals managing it. They're dealing with parental concerns. They're dealing with the requests of parents who are actually quite concerned and are shifting from in-person to online learning because of this. They're managing the realities of it. They're going to have to navigate how are they going to, carry out with assemblies and extracurricular, and how's the spacing removed from the classroom, how they're going to deal with sharing of resources and notebooks and all these things that are supposed to return to normal. Those are our concerns. The flexibility that they had, those who are the experts, take their advice. Our members are on the front line. The school boards aren't saying let's not let's not lift the masking mandate. They're saying give us some time so that we can provide the level of safety, the level of concern, and they want to be able to do it right. They want students to be in until June. They want parents to feel comfortable. They want to feel comfortable, and they want to be able to have the time to plan and to put the necessary things into place. This government has not been committed to long-term planning. We've been in and out of this pandemic, online, in person, online, inconsistency, because there haven't been any long-range plans. When you hear school boards are saying they need more time, they're saying they're concerned and they want to do it right. And I'm not really sure why this government will not allow them to invest in added safety measures, which only helps the students of Ontario, helps the educators and the community. Yes, there might be low risk for kids for contracting it, but they do spread COVID. Our members do get impacted. That creates inconsistency in the system. It creates absenteeism. Parents are looking for consistency. All these factors, many people are exposed, many people are at risk. Give us the time, give us the flexibility, which you've allowed before, so that we can do our jobs and students can enjoy feeling safe and comfortable engaging with each other.
Karen said a few things that I want to follow up with you. We've been hearing a lot that kids don't get as sick from COVID or don't get COVID. You're a teacher. Adults are the ones that are teaching students in classrooms. Something that we've been talking about again during the pandemic has been the mental wellness of children. There's been a lot of mental health impacts to children, learning from home, the back and forth, as Karen mentioned. What have you observed as a parent and as a teacher with children wearing masks and the argument that this is affecting their mental health and their ability to learn well?
It's such an interesting question. My own children have really taken on the masks and they've been wearing them and they've been really going through with everything that has been mandated. They also aren't really displaying. I mean, there's obviously some issues that have been going on for children, and I'm not belittling that. I have had students in the past who have had to walk away from online learning because it just wasn't working, and looking at a screen all day was very difficult for them. I'm not seeing that quite so much with my own children, but I did see that quite a bit with some of my students last year when we did go into the lockdown in April, and then we were on virtual school from April until the end of the school year. Some of the students just could not be there, could not attend virtually, not enough devices, just the inability to sit and look at a screen, losing that connection, particularly students who required additional attention, who required additional support. That didn't work out very well for them. We did try and work around that. We did try and offer some support, and we did also provide shorter classes to some extent, just to assist our students and to assist our staff as well, because we were sitting in front of a screen and teaching all day. So it was difficult. And, we did take a few times. We did take some classes. I did do this, and some of my colleagues did do this as well, where we just had a venting session and a schmooze session instead of an actual class where we could just, you know, connect with the students again, because that part was really missing. But one of the things the students really said when we were on Zoom again, it was really funny. They were like, I can see you. I can actually see who you are. So we did manage to build some connections in different ways when we were on Zoom, because I could see their face, they could see my face, and we could have that interaction. And we did build on that and did take that back into the classroom. But masks are hard for sure. Zoom is hard for sure. It's finding that balance. It's really difficult.
I don't want to put you on the spot, but you are going back to school on Monday. Um, how are you feeling about being in front of a classroom of kids with no masks and teaching? Do you feel safe?
Uh, well, I'm nervous. I am going to continue wearing a mask. I've actually had all of my students. It was really funny. I've had just prior to the break, my students were asking me what I was planning on doing when we returned back on Monday, and I said that I intend on wearing my mask because I am exposed to so many students over the course of the day, and my priority is to keep me safe, my family safe, and my students and their families. And I have a feeling that there will be a lot of students who will continue to wear, not a lot in my school. I don't think in my school there will be. I think most of my students will most likely take their masks off, but there will be a small minority who will still wear a mask. And I think it's important for them to see that their teacher is still wearing their mask and is still supporting them. So I'm actually very nervous about Monday going back. But I know that I'm going to maintain my mask wearing until I feel safe and comfortable. There's no numbers, there's no reporting, so who really knows what this is based on? My children are going to have made the decision to wear their masks as well. And like I said, I'll support them whatever their decision is. If they choose to take it off at some point, then that's their choice, and that's okay.
Tai, I mentioned that there are no numbers. Once upon a time, we actually knew how many cases were in schools. Now we don't. And in the adult world, we've seen videos of people pulling people's masks down. Masking has somehow become like a political issue. And I can only imagine how it's going to affect children now that it's going to be on the individual child to decide whether or not to wear a mask. How do you think this is going to affect how children play and socialize with each other?
Again, I think it depends on the school and the neighborhood. I think some neighborhoods would do just fine. I think the science table projections yesterday that came out suggest that numbers will likely go up with the dropping of some of these precautions, but not to the level where of the peak of Omicron just months ago. So some schools would do fine, but within that, I think you're going to see schools that are not going to do so fine. I think those are the schools that have traditionally had issues throughout this pandemic with high cases and low vaccination and perhaps, fewer people wearing masks. So we'll see. But, hopefully, I think in those high risk neighborhoods and schools that the parents are going to take a cautious approach and wait this out a little bit and keep their children masked as long as possible.
Do you think, though, because even now, before the mask mandates were taken away, some parents wore masks, others did not. But now when kids are seeing some of their classmates choosing not to wear masks for whatever reason, do you see that affecting how children interact with each other?
Yeah, I think there's going to be some peer pressure probably for sure. I mean, if you're a kid and all of your friends are unmasked, even if your parents are saying you should, I imagine that'd be very difficult, very challenging. I have 3 kids and they all say they want to keep their masks on, but if 80% of their classmates aren't wearing masks, I don't know what decision they'll make once they're at the school. So, and likewise, I think I did an informal poll on Twitter the other day or 2 days ago, and it turned out like over 90% of people that responded, it's not scientific, but said that they'd keep their kids masked. And if that was to occur in some schools, the peer pressure might be the other way around, where the kids that are unmasked might feel pressure to put their mask back on. So, yeah, we just don't know yet. We'll find out, I guess, on Monday.
I'm sure we're all going to be back talking about this. For me, I don't even know what to do. I don't want to put my kids in a situation where they have to feel as if they're being othered in the classroom. I think this is something that a lot of parents will be talking about over the weekend. Thank you all for taking the time to speak to us tonight. We really do appreciate your insights.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.